What are the three most important qualitative questions to ask when doing a dizziness case history? Number one, does it feel like the world is spinning in circles? Number two, does it look like the world is tilted to one side or another, or does it feel like you're being pulled to one side or another? Number three, does it feel like you're going to pass out? The reason why we ask these questions is to help differentiate where the problem is coming from. For example, in number one, we ask if the patient feels or sees that the world is spinning in circles. If the patient feels this, that is indicative of vertigo, which means that there's a problem with the canal, its neurological pathway between itself and the central anatomy, or the central anatomy that processes the canal's information. For number two, if the patient feels a sense of tilting or being pulled to one side, that indicates that there's an issue with translation or linear sense, which is an otolith issue. And finally, when we discuss the feeling of passing out, such as syncope, presyncope, or even lightheadedness, typically that's a problem with the blood. Whether that's not enough blood getting to the brain or the composition of the blood is off, such as a chemical imbalance of an electrolyte. Doc, we all have patients that have dizziness. Some get better from an adjustment, others don't. I wrote this handbook to serve as an introduction to dizziness management in a family chiropractic practice without having to change your systems and procedures. It is a perfect reference to help you help more of your patients without changing how you practice. To get yours for free, click on the link in the description or go to dizzinesscare.com.